So good afternoon, or good morning, or good evening, depending on where you are in the world. I'm really happy we have people all over the world joining us. On behalf of the Happiness Research Institute and Leo Innovation Lab, thank you all for joining and welcome all. My name is Meik Wiking, and I'm the CEO of the Happiness Research Institute here in Copenhagen. And we've been very happy to be working with Leo Innovation Lab since 2015 on the So Happy project. So our common goal is essentially to improve quality of life or happiness for people living with psoriasis. We're trying to put happiness at the core of what we're trying to understand, but also achieve. And I'll be presenting today the latest findings from our new World Psoriasis Happiness Report 2018, and I'm really excited about sharing the insights with you. I'd also like to introduce my awesome co-hosts. So we have CariDee English in Atlanta. She is a model, actress, and renowned psoriasis advocate. Welcome to you, CariDee. Are you on the line?
Yes, I am. Thank you for having me. Here I am. Here's my psoriasis. Yay!
And we also have Patrick Vuorio in New York. Patrick, the Executive Director for IFPA. So welcome also, Patrick, and thank you for joining us.
Thank you. It's very nice to be with you at this time.
We might also have Hoseah Waweru, who's the President of IFPA, joining us. We're a little bit uncertain about that because Hoseah is joining us from Kenya, so there's some issues with that line, but he might also jump in later on. So
I am actually on.
Great, wonderful, wonderful, great. Thank you for joining us, Hoseah, and we hope to keep you on the line.
Yes, and I want to say good evening or good morning to Patrick, and particularly also CariDee, who have met us on 2 occasions about psoriasis many years ago.
Brilliant. Thank you, Hoseah, and also thank you to all of you from around the world joining us. We would also love to hear from you. Comments, questions, send them our way. There is a small question box you should be able to see on your screen. We will try to cover as many questions and comments from you as we can at the end of this hour. Also, if you have questions and you want to address them to somebody in particular, just put in the name of that person that you would like to address it to. So keep comments and questions going, please. So let's just start with the context in terms of where we are sort of politically and in a happiness research point of view, because these are really interesting times to be a happiness researcher, because more and more organizations, stakeholders, governments are looking towards these new softer measures of progress. Well-being, quality of life, happiness is being incorporated as a measure of progress. So for us, it's been a step forward that the United Nations in 2011 passed the United Nations Happiness Resolution. And that basically asks all the countries of the world to focus more on happiness and well-being and see what they can do to improve quality of life. It's also the UN that commissions the World Happiness Report, and it is that methodology, that metric, and those benchmarks that we are actually building on in the World Psoriasis Happiness Report. We are also applying the guidelines that have been developed by the OECD. I should maybe also just ask CariDee, Hoseah, and Patrick, maybe for the next 20 minutes while I present. I think that might reduce some of the background noise I at least hear here in Copenhagen. So moving on and looking at the methodology, this report builds on a wide data set. So the awesome So Happy team has been able to collect data from almost 80,000 people from 21 countries, with samples ranging from 410 to almost 10,000. It's a self-selected participation, and also it is building on top of that huge data set we have from the first World Psoriasis Happiness Report. So in short, we have a lot of data, and this is just the very tip of that data iceberg that we're going to cover today. There's a lot more to dive into, so I encourage you to download the report, read through. There's a lot of super interesting insights that we won't be able to cover today. Also, I think it's important to underline that I'm going to throw a lot of numbers at you, a lot of data, a lot of percentages, but I think it's important to remember that, of course, behind all these data points are people and there are voices looking for and calling for happiness. So that's important to keep in mind. And these are the 21 countries surveyed in the report. So let's look at the insights we would like to cover. 4 of them. First, psoriasis drives happiness inequality. Secondly, investing in happiness for people living with psoriasis can help millions of lives and save society billions of dollars. Third, psoriasis takes a significant toll on people's mental and social well-being. And lastly, chronic care must recognize mental health. So let's start out with the first one, that psoriasis drives happiness inequality. And here it's important to remember that usually when we see happiness rankings, they are based on averages, which is fine. But it's also very important to start to look at happiness from a distribution or an equality point of view. So that's what we've been trying to do for the past 2 years with the World Psoriasis Happiness Reports. Also, usually when we talk about equality or inequality, we usually approach that from an economic point of view, which is important too, but equally important is also the health and well-being happiness perspective. So that's what we're trying also to introduce to the agenda. So this is the first graph I would like to show you. And in all honesty, I think this graph is a little bit heartbreaking. What you see here is the share of people who feel they are living in misery in our 21 countries. So misery is defined by using the Cantrell Life Evaluation Ladder that is also applied in the World Happiness Report. People scoring between 0 and 4 on this scale, which goes from 0 to 10. So people living with psoriasis, we see the share of them living in misery ranging from around 17% in Mexico up to more than 50% in China. And obviously, these numbers are quite sad to look at, especially when we start comparing them with how many people in the general populations live in misery. And we can do that by applying the Gallup World Poll. So if we take the US as a case, well, if we look at the general population in the US, we see that around 3.5% of people in the US are living in misery. And when we take the population with psoriasis in the US, that equivalent number is almost a third of all people. So the risk of living in misery if you have psoriasis is almost 10 times higher than the general population. And it's our point of view that we should focus our efforts on where well-being is most scarce. So to reduce misery among people living with psoriasis. So moving on to the next slide, here we have the overall country ranking in the World Psoriasis Happiness Report from this year. So this is the average happiness level for people living with psoriasis in these 21 countries. The happiness level is the white number you see in the blue bars. The number in the column under N is the sample size from that given country. The light blue color at the right end of the bar is the confidence interval we have within those samples. So the bigger the sample of people we have in a country, the more certain we are that we are hitting the number correctly. We see the same pattern as we saw last year. Latin countries are doing fairly well. Mexico, Colombia, Spain, Brazil, again, at the top of the list. At the bottom, we have China. The US comes in 13th place. New countries are Belgium and the Czech Republic. So From a happiness research point of view, the interesting or most interesting point here is that we again see that countries that usually do well in the conventional World Happiness Report, countries like Denmark and Norway, Canada, Australia, they're actually quite far down the list. And we have different theories of why that is the case, why it might be more difficult to be unhappy in those otherwise happy societies. And some of those theories we unpack and unfold in the new report. So I encourage you to look into that. But again, we find that people living with severe psoriasis are a lot less or significantly less happy than the average citizen in all the surveyed countries. So there is what we call a happiness gap between the average citizen, the average happiness level in those countries, and for people living with psoriasis. And it's that happiness gap that we're trying to overcome. So moving on, the second insight is that investing in happiness can help millions of lives and also save society billions of dollars. And what you have here is a graph that shows you the adjusted cost of psoriasis in the different countries per 100,000 people in employment. So it's adjusted for purchasing power. And what we see here is that France has the far biggest cost of psoriasis. Per 100,000 people in employment, the cost there is $75 million. So almost twice as much as number 2, Germany, and almost 3 times as much as Denmark. It's important here to mention that the cost is purely calculated on the loss in productivity. So we're not talking about the cost of healthcare, and not to mention at all the human cost, of course, there is from living with this disease. And we just, if we zoom in on the US, we can see there that per 100,000 people in employment, the cost in lost productivity is around $20 million. But if we look at the entire population, well, that is accumulated up to $30 billion per year, or the equivalent of 0.16% of GDP, which could potentially be saved. The equivalent numbers in the UK is around $8 million per year per 100,000 people in employment, or 2 billion per year as a total for the population, or 0.09% of GDP. But as mentioned, these are only the costs due to lost productivity, not the healthcare cost, and not at all the human cost. So that's why we want to echo the point that the World Health Organization have been mentioning for years, namely that investing in mental health is a good investment and it needs to be prioritized. For every $1 we spend on helping people with common mental illnesses like depression, like anxiety, we gain, or the economy gain, an average of $4 in return. Also, in this point, we want to underline again and again, like we did last year, that psoriasis is not just a skin disease, but it has severe negative impact on people's mental health. Here we also have an example of the relationship between loss of productivity and mental health. We see that the bigger the impact, the more severe depression or anxiety, the more days are lost or more hours are lost in the past 4 weeks. And that brings us to the third point, that psoriasis takes a significant toll on people's social and mental well-being. What you see here is a graph that shows what other diseases people are also dealing with when they have psoriasis, which comorbidities do we see. And as an example, around 25% of people living with psoriasis also experience depression or other mental diseases. Each of these diseases, of course, has a negative impact on people's quality of life. What we presented with the blue bars, those 3 diseases, when we control for socioeconomics and when we look across all the countries, have a significant negative impact on people's well-being. So it's important, especially to be aware of those 3 diseases, so back pain, depression, other mental diseases, and liver diseases. So moving on, this graph also illustrates the relationship there is between mental illness, depression, anxiety, and happiness gaps. What we see here is the bigger the happiness gap in different countries, the bigger is also the prevalence of these common mental health diseases. So lastly, the final point we wanted to highlight is that chronic care must recognize mental health. We also hit that point last year. Last year we found, unfortunately, that 50% of people living with psoriasis don't feel that their doctors fully understand the impact that their disease have on their mental health. And furthermore, what we saw was whether the doctor fully understand the impact that psoriasis have on their mental health also explains their happiness gap, and it to some extent predict the happiness level. So that's why we wanted to dive a little bit deeper into that this year and give you a little bit more details in terms of that area. So we've asked people a range of statements and asked them to answer how much or whether they agree, strongly agree, and so on with these statements. And I think there's good news, bad news, and an ugly truth with this graph. I think the good news is that fortunately more than or the majority of people feel that the doctor talks in terms they could understand. I think the bad news is that there's room for improvement in all of these areas, in all of these columns. And I think that the ugly truth, unfortunately, is that the element that seems to best predict whether people are happy or not, namely whether their doctor is interested in and understands the effect that psoriasis have on their mental health, is the thing that is least likely to happen. Only around 1 in 4 agrees with that statement. So a lot of room for improvement, especially on that one. To sum up, what we would really like to recommend based on those insights and on the entire report are the following things. But before I go through them, I just really encourage you to keep the questions and comments coming. We'll be taking them at the end of the session. Again, if you want to address them to somebody specific, whether it's me, whether it's CariDee, whether it's Patrick or Hoseah, let us know in your comments, and there's a little comments question box you should be able to see on your screen. But to sum up, our hope is to put happiness, well-being at the core of what we are trying to understand and achieve, and these are our recommendations for actions, namely that investing in mental health for people living with psoriasis may help millions of people across the world, but also help societies save billions of dollars by cutting the cost. We also find that happiness inequality related to psoriasis is better explained by our mental health, social isolation, rather than lifestyle behavior and objective health status. So we need to recognize the impact that mental health and social well-being have for psoriasis. And this goes for policymakers, patient organizations, and the global health agenda in general. And when it comes to healthcare, we need better processes to address mental health aspects in psoriasis. We need subjective well-being. We need happiness to be part of metrics, of conversations with patients, to be part of tools, to be part of the solutions, the treatments that we offer to patients. So my last plea is basically for help, and that is to you guys, the audience. Help us in getting the word out there. Help us in spreading the insights from this report. What you concretely can do is download the report. We will also send it to you in a follow-up mail tomorrow. Pass it on to people you know. Pass it on to people you believe need to hear this, people who need to understand the insights in this report, people who are the ones that can bring about the change that we need. We got good news in that department on Monday. we presented these findings at the United Nations General Assembly in New York at the Danish Prime Minister's meeting, and got really positive feedback from the Danish health minister. So we are already trying to spread the important insights, and we really also would like your help in doing that. So with that plea and that hope, I would like to also hand over the word to Patrick and Hoseah. Are you still with us?
Patrick is here.
Good. And Hoseah, do we have you as well?
So,
We might have Hoseah as well, but Patrick, maybe you can lead us in. We would love to hear how IFPA plans to use these insights going forward.
Yes, well, thank you very much. We're very glad to be part of this conversation, and I think as a starting point, I think seeing the report come out is actually having a very good happiness impact on our team, such as it were. I'm actually finding myself in New York, as you mentioned, in connection with the UNGA and also the United Nations high-level event on NCDs, on non-communicable diseases. So actually this report and its findings will be a very natural thing to take with us also in all of those conversations that will be happening in the next few days. The meeting is actually tomorrow. So that's excellent timing. I think for anyone who's not perhaps familiar entirely with IFPA, the International Federation of Psoriasis Associations is a patient organization on a global level, essentially joining patient advocacy organizations across the entire world. We have 56 member nations, and these are essentially the organizations that are carrying our message forward globally when it comes to advocacy for the over 125 million people living with psoriasis and arthritis. So essentially, data in general, such as this, is of course extremely significant for our advocacy, as it helps us answer questions we are asked in real-world advocacy. And definitely tools such as this report can serve as powerful evidence to support our cause as we interact with government stakeholders to essentially affect change in healthcare systems and other arenas. So I think the findings in this report are very interesting, as they provide grounds for a substantiated call for more research as well into happiness among psoriasis patients. Is obviously something that has a tremendous impact. And there's clearly a disparity, clear differences by nation. Very interesting, but as you say, also in some sense a bit distressing to see the results, the actual impact for so many people, and definitely that shows very clearly that it's so important to better understand the happiness gap so that we can focus our advocacy efforts as well. And IFPA is working intensely with that. Again, the timing, of course, of the report is excellent in connection with the UN General Assembly, which means that for all engaged stakeholders, this can take place immediately. And I think for IFPA, it's also very useful in the sense of part of our case is always to further the understanding of how psoriasis is so much more than a skin disease, and particularly the comorbidities, of course, including mental health issues. And I think here, I recall a few months back in May in Geneva, we of course had the opportunity to, together with the So Happy team, IFPA hosted an event in connection with the World Health Assembly in Geneva, together with the NCD Alliance. It was extremely well attended and actually received extremely positive feedback. There was a very, very strong positive reaction to well, actually the angle of happiness was a surprise to many and very well received as such. The theme was essentially happiness and NCDs, and I think that was a very good example of how this conversation still has a long way to go, but it's being well received and is absolutely critical to making an impact when it comes to the mental health or well-being element for people living with psoriasis. So I think from our end, we see the need for even better and clear guidelines for supporters and healthcare providers in terms of quality of life for people living with psoriasis, the understanding of how psoriasis can impact a person on so many levels, being a complex disease, which means it's quite difficult to bear, and the happiness of people actually being quite significant as a factor that needs to be strongly considered when forming a plan for care, and not just the external or physical measures of the disease, which so often is the case of focus. So I think with that, this financial aspect very well shown here in terms of the actual financial case as well on national or larger levels in terms of societal social impact. It's a very strong case for actually investing in measures and efforts that can actually help with these elements. I think that is a very strong case that makes it easier to have the dialogue with government, with healthcare authorities, and so forth. And that's why, well, at IFPA, we're also very happy to support this research efforts like psoriasis and processing. Psoriasis, living with psoriasis worldwide. And actually going forward from our end, I think what happens next, obviously again, a high-level event on NCDs in connection with the General Assembly. That means even tomorrow we will have great use of that as part of our toolkit. And of course, on 29th of October, we have World Psoriasis Day, where essentially that's the key, obviously, of course, extremely engaged patient advocates all across the world joining to really bring forth the message on behalf of the 1.5 million. And I think we will obviously be distributing the report results to our membership, and that means our on national and regional and global level. The findings in this report in straight message, really have this aspect to be part of the dialogue. So I think that is where we find ourselves right now. And for the happiness factor is positive, since we said so much.
Oh, sorry, Patrick, you were breaking up a little bit. Could you perhaps repeat the past 10 seconds for us?
Oh, yeah. Well, sorry. Well, actually, I was just essentially wishing us good luck in the continued efforts and showing appreciation of that we can be here at this moment and see this report come out. And it's an exciting moment. I don't know if we still have Hoseah with us. If we can take another attempt for any comments there.
Yeah, Hoseah, do you want to add something?
Thank you very much indeed. I think I actually want to congratulate your team because this to us in IFPA, the International Federation of Psoriasis Associations, is a very, very powerful tool in our advocacy work because it also shows exactly how over 125 million people in the world are affected. And we will see also that it also raises a point that we can now approach the healthcare providers, governments, with this type of tool. It is a very, very powerful tool, as Patrick has also said, and we certainly will be able to use it among our members and also among the other stakeholders in the psoriasis fraternity. So thank you very much indeed, and I really congratulate this, and also it being rushed when we are having the UN General Assembly meeting and the NCD Alliance activities around New York. I think it's also going to have a very, very wide application also. Thank you.
Great. Thank you both to Patrick and Hoseah. My main takeaway from your very good points here was how powerful a tool it is, and also to, I think, what you said, Patrick, in terms of how versatile a tool it is, that we can use both at the UN General Assembly, at EADV, but also I think it's a tool, it's a report, it's a conversation starter with patients. And in my experience and my colleagues' experience, a lot of people who are living with psoriasis has also come up to us and said, "Thank you guys. You know, this is a report where I feel heard for the first time. And I like that we are bringing a voice to a lot of people around the world, and also that we're developing something that can be used for people living with psoriasis, but also to address the issues at stakeholders in the UN and so on. So thank you for that overview of how you are going to use it at IFPA, Patrick and Hoseah, and also brilliant that we could reach you from Kenya, Hoseah. I was really happy for that contribution. And now I'd like to hand over the word to CariDee, as mentioned, actress, model, and psoriasis advocate. And CariDee, can you shed some light on, do you think that these insights, these findings, do they reflect your experience with psoriasis?
Yes, they definitely do. Hello, everyone. I have psoriasis. You can see it right here. Yeah, it definitely, mental health is a big impact when it comes to psoriasis. It's obviously a physical disease, an autoimmune disease, but the mental health impact is incredible, especially with children. I developed psoriasis at age 5, and it completely shaped my personality, my outlook, insecurities, all of it. Mental health is a big issue when it comes to psoriasis, yes.
Great. And is there something in particular in the report that you want to highlight or bring forward that you sort of feel reflects the experience that you have had?
Well, I wrote a little thing about my experience. If we have time for me to share it, I'd love to read it to everyone. And maybe
yes,
that will kind of, I really would like to just share my story, and thank you for everyone that is listening. And I am speaking on my experience with psoriasis, and I know there's many people, and I'm honored to be able to do that right now. So I'm going to just read something that I wrote, and here we go. Everyone has their psoriasis story, and I encourage others to speak often about their experience with psoriasis. For awareness is power, and within power holds my commitment to living happy with psoriasis. My psoriasis story starts as a little girl driving in the back of my mother's Mercury. I noticed something red on the back of my leg, and I thought to myself, this doesn't look like a bug bite. This looks like a rash. This is something new. What are you doing here, and how long must you stay? I remember calling out to my mother, showing her my newfound patch, and I remembered the look she gave me. It was a look of sadness, and I knew right then and there that mentally this was something that made my mother sad. I didn't really understand. My mother immediately brought me to a doctor called a dermatologist, and I had left the office being diagnosed with psoriasis. My mother explained that it was hereditary, autoimmune, and not communicable disease that was passed down from her, and we both had it. At the time, I didn't really understand those big words. I just wanted to keep living my life and not have psoriasis be a part of it. I had no idea at that time that the mental health impact of having psoriasis was just introduced to me, and little did I know an abusive relationship I would have in my life just started. As I grew older, my psoriasis grew with me, a constant unwanted companion with even more unwanted attention. Growing up can be difficult enough, but growing up with psoriasis shaped the personality I have today. I figured if I was really outgoing and funny, I stood the chance of people seeing who I was before they would see my psoriasis. This meant I had about 5 seconds to create a great impression, and this is a clear sign that psoriasis was impacting me on a mental health level. I was changing my personality, and I was altering it to accommodate my psoriasis. And it's really important for me to say that yes, psoriasis is a physical disease, but many don't realize it gets covered up not only by clothing, but a change in mentality. How psoriasis works is beyond skin deep, and I hope that we can start treating psoriasis on a mental health level as well as physical. I remember, I can tell a story about when I was little. I would go swimming and I would put on like 6 pairs of, or not 6, but like 3 pairs of nylon so people wouldn't see my legs, and I was able to swim. And at one point I got kicked out of the pool because the other children and parents thought, I had a disease that was communicable, like the people were going to catch it. And I remember I just remember that feeling, and I felt I felt kind of a body shame at a very young age. And shame, by definition, is a painful feeling of humiliation and distress caused by the consequences of wrong behavior. And shame is a weight, and it's far too heavy for any child to carry and any adult. And another fact that my psoriasis impacted my mental health and my physical health second. So, I could talk about going into junior high and going into high school and how that in its own thing with mental health is already impactful, but having psoriasis on top of that, it's completely impacted my personality. And I think this happiness report is so important. And I really believe that there is no cure for the mental stigma of having psoriasis. And as I get older, I have a passion to shed light in the dark tunnel. I commit for a large awareness of the mental health impact psoriasis has for my future daughter or son, or for any children, women, and man that are listening now. I'll carry psoriasis as part of my story to show that there's no shame in it. And I can express the amount of gratitude I have now that I have my disease and I don't let my disease have me. Happiness is a pursuit, and the pursuit of psoriasis makes me very happy. So that's from a patient standpoint, my standpoint, anyways.
Thank you very much, CariDee, for sharing that with us. And I think a lot of people are sharing that experience you have. You mentioned the going to the pool with the risk of being kicked out. We can see a lot of the participants we have in our surveys have had similar experiences. And a lot of our participants are also asking us to help create more awareness about psoriasis, because I think there's a lot of stigma, a lot of misunderstanding around the disease. And also, as a happiness researcher, it's heartbreaking to see, and it's also interesting that because we have participants from so many countries and data from so many countries, it's interesting to see how similar people are, because it's the same things people hope and dream about, whether they're from US or Denmark or China and so on. I think we might be Americans and Danish, but we're first and foremost people, and that's also what we see in people's answer when we look at people living with psoriasis. They dream about the same things. They dream about going with their kids to the beach. They dream about sitting on the bus without the fear of people moving away from them, wearing T-shirts every day, ordinary hopes and dreams from around the world. So thank you for sharing that. Thank you also for being the light in the tunnel. A lot of people, including me, are appreciating that. So thank you much. Thank you very much, CariDee. Also, we have 20 minutes left, guys. Thank you for all the great questions and comments already that have come in. Please keep writing, asking, commenting. The ones that we won't be able to cover in today's session, we will send out a follow-up mail to the participants where we will answer the questions that we didn't have time for today. So let's get cracking on your questions. And here's the first one from Lars Werner. Do we know if the lack of happiness is related to the skin, pain in joints, or other comorbidities? Is the question. And yes, it's significantly related to depression, back pain, and liver disease, even when we adjust for all other factors. So all comorbidities still may have a big negative impact on the individual, but these three factors have a universal negative impact when we control for the other factors. So thank you, Lars, for that question. Should we follow this one, or are we follow here? Okay, also from Lars. So the question is, in the US, happiness level of people with psoriasis was a factor 10 lower than the general population. What is the factor of the Nordic countries? So we only have the benchmark for the US, but I can tell you that the average happiness level in Denmark, when we look at the World Happiness Report for the general population, is around 7.5. And let me just find you the number for people living with psoriasis. Well, the number for people living with psoriasis is in Denmark is 5.9. So 1.6 lower on this 11-point scale. We see that level in Denmark. How's the Danish? This is Lars again asking the question. We will take other questions as well. But Lars again asks, how's the Danish health minister involved in this? What actions is she willing to take or implement? She is not committed to anything. There was no formal involvement. She was in the audience on Monday at the presentation at the United Nations General Assembly. But I think she called it elegant, and she would love to follow. The report and the findings were elegant, and she would love to follow it. And we're in the very beginning of our conversation with her. So also Lars here, thank you for sharing your story, CariDee. Lars says, do you or the photographer hide or retouch your model pictures?
You know, yes, they do. But I have done, you can even go to my Instagram, I have done a full photo shoot where there's no retouching of my skin, and I'm actually in a full flare where the psoriasis is covering 80% of my body. Those pictures I chose to take on my own, and I wanted to show not even just the psoriasis community that I'm being proud to wear my spots, and I also wanted to show other people who don't understand psoriasis, this is what it looks like. And this is, I mean, it just feels like it was such an important thing to do. And I mean, when it comes to my professional shots, they do you know, touch them digitally, and everybody gets digital retouching though, so it's not, you know, they're not segregating me because I have psoriasis. Everything gets retouched these days. I mean, filters are everywhere. You can have whiskers now and make a video and post it. So yes, I get retouched, but I do have photos that I just took with a huge flare, and it was an impactful thing for me as well, because I broke through an insecurity that day. So please go ahead and Google, you know, me with psoriasis, and you'll see how my case is and how much psoriasis I do have.
Thank you, CariDee, and to Lars for all those questions. So we also have a question from Fanny Gaudry. I think it's pronounced. Fanny asks, how can you explain that the cost in France is so high? And here Fanny is referring to that slide I show you with the cost of psoriasis. France, it was $75 million US per year per 100,000 employed. And the answer there is that one of the reasons is that the prevalence of psoriasis is so high. So if you have 100,000 people employed, if a larger share of them have psoriasis, naturally the cost is going to be higher. And it's, for instance, a lot higher than Greece, and was further down the list. Another factor is the prevalence of mental disorders, but this is one of the areas that we need to explore further. Like last year, we also looked at the question, why is it that, for instance, the Nordic countries that usually do well in the World Happiness Report, why are they so far down when we look at psoriasis? And developed at then 2 different theories, and now this year we've gone a little bit further into this. So now with the new report we have 4 different explanations. So we continuously use the data and sort of dive into the data to understand better some of the things we are seeing, and this would be one of the areas where we will take a deeper dive. And I think this is also the great things about the data set, that when we have conversations with policymakers, with people like you, with patients, with people living with psoriasis, with doctors, they ask us questions, could you look into this for us? So I remember last year at the EADV in Geneva, there was a doctor asking us, could we have a look at whether having psoriasis on your lower leg, whether there's a bigger negative impact in warmer countries, simply because of the fact that you are more inclined to wear shorts in those countries than you are, for instance, in Denmark. So we continuously use the data. So thank you for that question, Fanny, for bringing that up. And then we have another question from Emma Townley, who asks, would I be able to use the information provided and screenshots I have taken in my blog? Yes, please do. Emma will send over materials in a follow-up mail for you to use. That applies to all of you. The report, use the slides as much as you want. We'll also send you social media assets so you can help spread the insights and the findings in the report. So, so thank you, Emma. Yes, please use as much as you can. And Emma also asks, will you be looking into getting research stats for those people who live with someone who has psoriasis, effects on their lifestyle, mental health, etc.? Yeah, so going beyond the patient is something that we have talked about. I'm actually not sure where we are in that process, but naturally it's part of the landscape that we would like to explore. So this is our second report in our third year, and we continuously find new areas that we want to expand into, but also dive deeper into, and this is definitely one of them. So let's see here. Fanny again asks, is there already tools validated by physicians to evaluate happiness of patients with psoriasis? Well, that's what we are trying to do. So we are also using some of the conventional ways, the DLQI and other ways of measuring quality of life, and seeing how that fits with happiness metrics. So there's a comment from Claire Layton. Congratulations on this great report, which has great potential to impact the lives and happiness of many people worldwide, and thanks for inviting us to the call. Well, thank you, Claire, for joining us. We're really happy to talk about these findings. We want them to be spread as much as possible. So I think that was the sort of end of the questions, at least the ones I can see here. I'm just going to give you a few more moments to add any additional questions. So is this a question? Yeah, so okay, so this is for CariDee. This is from Josephine, who says, having psoriasis myself, I know a lot of things can trigger your disease, from stress to weather. How have you taken control of your disease when your own body becomes an enemy?
Oh, I know that feeling, and thank you so much for all the patients thank you for that question. Yes, it's crazy to have your own body attack itself, and when I go under stress or when I'm sick, even sometimes, I didn't get to shave my legs until I was 25 because I would cut my psoriasis on my legs and then it would grow more. So there are constant things in life that create flares or create more psoriasis, and what I try to do, I try my hardest to remain calm, kind of switch my diet up. I try to take out dairy. I try to take out acidics. I take, and God bless anybody who gets close to me when I take this vitamin, but I take liver cod oil, and it really does help with skin and it helps with joints. I've developed psoriatic arthritis as well. My mother also passed that on to me. So the cod oil has really helped me, and I know that's it's something that doesn't smell the best, but it's helped. And anything that really preserves, like self-love, I'll work out, or I'll get, something that just helps my body move, because I really want to isolate and hide when my psoriasis is flaring. And that's something that is hard to break out of that. And also I encourage going online and just talking to other people, because support is stronger than anything you could do to help maintain psoriasis. So that's my opinion.
Thank you, CariDee, and thank you, Josephine, for that questions.
Thank you.
Question. So there's a comment from Emma Townley again, who writes, "Thank you so much for this webinar, answering my questions and for all the work you do. Also, big thanks to you, CariDee, for being an absolute inspiration, especially to females who live in a world where we are told to look a certain way and be perfect. So keep up the amazing work, everyone." So thank you so much, Emma, for that comment. So I think we are sort of at the end of the question list. Again, if you have questions, you think of questions, again, put them in a comment box or write us, and we'll try to cover those questions when we follow up. So tomorrow, all participants or registrants to this summit will receive an email, like I mentioned before. Link to the report will provide you with social media assets, so you can help us spread the findings on social media. We'll also share some images and some videos. So thank you all for joining from New York and Atlanta, and we have sirens in the very good, and Kenya and around the world. Thank you all for joining. Thank you to my wonderful, awesome co-hosts, Hoseah, Patrick, and CariDee, for being absolute stars. And thank you all guys for joining. Thank you in advance for helping us spread the very important findings. So we'll be in touch. Stay tuned, and thank you for this time around.
Thank you.
Thank you very much. All the best.